It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheetham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheetham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheetham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everyone. Welcome again to another live round of Katz's Corner here on WABC Radio in New York. I'm live here at 1-800-848-WABC. That's 1-800-848-9222 on what's going to be a beautiful Sunday. So I'm so glad that you could join me, and my wonderful producer in the studio, Mike. Good morning. How are you? You're giving me the thumbs up sign back there. Welcome, everyone. My co-host, Dr. Cheetham, is away for the weekend, off on vacation with her dad down in Florida. But I'm here. We've had a very busy week, and I want to remind everyone again, next Sunday, well, actually, hold on a second. Next Sunday is Father's Day. But next Saturday, well, we all know what that is. Next Saturday is what? The Men's Health Seminar. We've been talking about it for a few months now and planning, and I'm really excited about this seminar. It's turning out to be a wonderful group of physicians. We also have an acupuncturist who's going to be talking, Jillian, about the role of acupuncture and integrative medicine. Integrative medicine, I mean, it's here. It's we need to move into the field of, or the arena of bringing this to the forefront, integrative medicine. And a lot of the women have been driving this field, and now more men are getting involved. So the day will comprise, areas of prostate health, sexual health, and then integrative health, both sleep disorders we'll talk about, cardiac health, bone health. And there are a few seats left. We've had wonderful response this year, but you do need to sign up. That's at menshealthseminar.com, menshealthseminar.com. And it'll be next Saturday at the beautiful Garden City Hotel. So that will be wonderful. This week, we had the opportunity to go on with Don Imus on his show on Friday morning and talk a little bit about the seminar and also about the new prostate cancer guidelines, the screening guidelines that the AUA has come out and said with a panel of experts that we no longer should be screening men under the age of 40 and over the age of 70. And if you're between 40 and 55, probably you should be screened once every other year if you're a high-risk guy, African American, or a man with a family history. But and then if you're between 55 and 70, then you get screened even if you're an average risk guy with the PSA. So the PSA is still here, and I think it's the test is a great test, and it's the only screening test that we have right now for prostate cancer. There are some pitfalls to it. There's some false positives, and we all know about those. But we need to keep the PSA here for sure. Otherwise, we go back to the old days when I was a resident, as I talked about on the show this week, where men would come in and we didn't have the test to be screened, and men would come in with advanced prostate cancer. So we've seen certainly an explosion in the number of prostate cancers that are detected now, much earlier stage of the disease, much more curable. And in fact, many of the men can go on to the Katz protocol, which is the active holistic surveillance. And a lot of the patients that I see, I probably follow about 300 or 400 men right now on active holistic surveillance at Winthrop, and including the diet, exercise, and yes, following by PSA and by MRI once a year. We'll talk about all of this. And Dr. Cheetham, I know, will give an update on PSA screening. We'll have Dr. Mellinger talk about sexual dysfunction, and then we have some experts in other areas that pertain to men's health. So that's menshealthseminar.com. I also want to remind everyone that we are running now a men's health educational series, a support group for men, and it is on Wednesdays. The next speaker will be who's been a guest here, Dr. Brett Mellinger, and he'll be talking about sexual health and erectile dysfunction after prostate cancer therapy. It'll be at 6:30 in the evening. It'll be this Wednesday, June 12th, at the Winthrop Wellness Pavilion. And if you want to get more information there, you can register by calling 516-663-2251. That's 516-663-2251. Or you can email at prostatecancersupport@winthrop.org. That's prostatecancersupport@winthrop.org. And we look forward to seeing all of you. That would be, again, on June 12th at the Winthrop Wellness Pavilion. That's 1300 Franklin Avenue in Garden City. We'll take your phone calls at 1-800-848-9222. I know we were talking, I guess 2 weeks ago about kidney stones. And interestingly, I'm on call this week because Dr. Cheetham's away, so I got a phone call yesterday from a patient of mine who said, "Oh, Dr. Katz, I've got this terrible pain in my side, and it's going down towards the groin," and certainly he had to spend the morning in the emergency room, unfortunately, getting IV fluids, getting a CAT scan with a very small kidney stone that was going down the ureter. He just, the weather changed. He has a high uric acid level. He does have a history of gout, and gout is a condition where if you eat red meat or red wine or rich foods, or you have a family history of this, it can cause pain because the uric acid builds up in the joints, but also uric acid can build up in the kidneys. And when the weather gets a little bit warmer, and if you don't drink enough fluids, you can develop a small little stone, a uric acid stone. That's exactly what happened. And by giving more fluids, you can, and he needed some pain medication because this is very, very painful. He was able to pass a stone and leave the emergency room in a couple of hours. We'll have a few phone calls at 1-800-848-9222. And we'll hear from Harry in Manhattan. You have a question about some vitamins and prostate cancer. Good morning, sir.
Good morning, Dr. Katz. What is the link, if any, between vitamin E as one cause of prostate cancer?
Well, thanks very much for your phone call. And there have been studies, probably the largest study that was published a couple of years ago, looking at the role of vitamin E and selenium in prostate cancer, called the SELECT trial. I was participating in that trial. I was one of the centers that was running it. It's 35,000 men that were enrolled in that trial, Harry. And, there was a Finnish trial that in Finland that looked at the incidence of lung cancer, actually. They wanted to see if they could reduce lung cancer by taking high doses of vitamin E. Actually, that's not true. It wasn't high doses. It was 50 milligrams. Actually, it's a very small dose. In fact, if you go to a health food store, you can't find, if you open up a bottle, look on the back of the bottle of a vitamin supplement, there are at least 400 units of vitamin E. But this Finnish study looked at 50 milligrams, 50 units of vitamin E to see if they can prevent lung cancer. Well, the bottom line is it didn't have any effect on lung cancer. And in fact, to get into the trial, you had to smoke 3 packs of cigarettes per day. Okay, no effect on lung cancer, but it did have an effect, the low dose, on prostate cancer. So the United States government said, hey, let's do our study and see if we can do a 7-year study. We'll give men 400 units of vitamin E and see if we can prevent prostate cancer. And we'll also randomize it. We'll give them some guys some selenium and some not selenium, and we'll see. Well, the fact is, the bottom line is then they didn't use they didn't use the active form of the vitamin E. They didn't use the gamma tocopherol. They used the alpha tocopherol. And a lot of the integrative people know that that's not the biologically active form that will be the most potent antioxidant. So the government got it wrong. Actually spent a lot of money doing this trial. But anyway, it was a negative trial. So, And the selenium arm also didn't seem to affect the incidence of prostate cancer. The selenium aspect was because of skin cancer. There's a lot of studies that show, especially out at the University of Arizona, that show that if you take more selenium, the men that have higher levels of selenium, and you know what? The best way to measure your selenium is not in your blood. You ready for this? It's in your toenails, right? You got to take a little clip of your toenail and send it to the lab. That's the most accurate way of measuring selenium in the body, not the blood. But the Clark study, which was down at the University of Arizona, showed that if you take in more selenium and have higher levels in your toenails, you're going to have a lower incidence of skin cancer and prostate cancer. But you needed to take the yeast form of the selenium, and that was not what was used in the SELECT trial. And again, unfortunately, the selenium arm did not appear to reduce the incidence of prostate cancer in those men. So, what do I tell my patients? It's good. I think that, if you eat a healthy diet, and a lot of the things that I have in my protocol, the green leafy vegetables, the kale, broccoli, spinach, high levels, organically, you can bring this into your body, and you don't need to necessarily supplement with more vitamin E. Now, there have been a lot of cardiovascular studies, interestingly, showing that in men that have a cardiovascular history, taking a little bit more vitamin E can actually reduce your incidence of getting a stroke, probably because of its ability on platelet aggregation and its ability to thin the blood. So it may have a role there. Let's hear from Richard in West Milford, New Jersey. Hello, sir. How are you?
Hey, very well, Dr.
Just going to use my little British accent there because Dr. Cheetham is away. All right. Here we are.
Thanks for taking my call.
You're welcome, sir.
You since your first show way back about 3 years ago on Mother's Day.
Wow.
Yeah,
are you going to come to the seminar?
Well, I'm going to see. I'm going to try to. I live out in West Milford, New Jersey, which is pretty far for a little bit.
Well, you don't need a passport to get to Garden City. Come on, Richard.
No, I don't.
Well, thanks for listening. I appreciate it. How can I help you, sir?
Well, I tell you, I've been suffering from prostatidia for about, the last 10 years. And I've had a couple of biopsies, and I've had rising PSAs. And my question really is does prostatidia, is there anything that could be done for that? And how does that affect the level of the PSA?
Prostatidia. I mean, it's a term we don't use that often anymore. I mean, what are your real symptoms? I mean, are you
Well, basically, what it is that you have pain in the area,
right?
Pain around the pelvic area, below the prostate. You do see sometimes, once in a while, when it becomes inflamed, of complete emptying. Possibly.
I'll tell you, one of the great roles of acupuncture, Richard,
Yep.
has been in this area of prostatidia, of pelvic pain, prostate pain, chronic. Have you tried it?
Yeah, I've been going.
Oh, you have been going.
Yeah. What my urologist is suggesting for me now is I've had 2 biopsies over the last, I guess, 3 years.
Yeah,
and my PSA was never below 4. It was 4.4, 4.8. It went from 5.4 to 5.9. So he wants to do a third biopsy.
Yeah, Richard, don't do another biopsy, okay? I mean, putting more needles into the prostate is also another source of inflammation and can cause more pain. I mean, first of all, I would probably get an MRI just to see if you have something in your prostate. Get a 3T MRI. You live in New Jersey. You could go up to a Holy Name Hospital there if you wanted to go locally. And see Dr. Jackie Brunetti over at Holy Name and get a 3.0T MRI to see if you have something in the prostate. Just because your PSA is up, it's nonsense. I mean, you have this prostatitis, you have pain, you have inflammation there.
Right.
Have you been on any of the herbal things? The herbal formulas, the herbs that are wonderful for reducing inflammation, things like, actually green tea can be helpful, but also scutellaria. Have you heard of that? Rosemary, ginger.
Okay, ginger.
There's a whole body of literature on high levels of ginger.
Really?
Oh,
that's interesting. Because I tried actually. There was a book or something that were trying bee pollen, and
I've seen some work on bee pollen.
I've tried that a little bit, and also there was something I read actually in a book for the Mayo Clinic, and what it said was, interestingly, and you know, I respect your opinion more than anybody, and that if you've had 2 biopsies, the chances of having prostate cancer would go down considerably.
That's correct. That is absolutely correct. Especially clinically significant cancer. Like, are you you've had 2 12-core biopsies.
Yes, sir.
What's the likelihood of you finding like a significant cancer that you're really going to need treatment on the 3rd one? It's probably around 10 or 15%. It's pretty rare. And I wouldn't be sticking needles in your prostate. But to get back to your point about integrative therapies for a condition like yourself that you're having with inflammation, it would be the herbs, acupuncture. Certainly, there may be a role for biofeedback and pelvic floor relaxation techniques. You know, I don't know. Are you undergoing a lot of stress as well?
There always is. And when you're a commissioned salesman, you always get stress.
Oh, yeah. No, I know that. I grew up, my father was in sales, and, you know, our income was based on commission. You get a bottom line salary, but you're basically making it on commission, so you're under stress. And, you know, how old are you, Richard?
I'm 65.
Yeah, so, you know, 65, stress can come out in a lot of different ways. You know, it can come out as an ulcer, it can come out as a heart attack, can come out into your prostate as well. And I've seen it. I've seen a lot of guys that work down on Wall Street and financial district. They're under a lot of pressure and stress every day. And young guys, too, 30s, 40s, that come in with this type of a condition. And, you know, the typical knee-jerk response by many urologists is, let's give antibiotics, let's give antibiotics. That's so wrong, because rarely is it an infection. Rarely. Now,
I've had all those. I have no infection there.
Yeah. Did you ever you could get a semen culture too, which, may sound like a little embarrassing. You don't want to go to a lab and, give a semen culture. But, that is something that you could consider, especially if you've been on antibiotics, because we're seeing more of these resistant organisms now, especially in the community. And that's really one of the reasons you want to stay away from too many biopsies, is that you can wind up, because you've been given. Actually, we just looked at a study that showed that men that had gotten Cipro, which is a very common type of antibiotic that we give, if you had Cipro in the last 3 months and then get a biopsy, your risk of infection increases, because just by taking the Cipro, you're getting rid of the good healthy bacteria, and the bacteria that's staying behind are the Cipro resistant ones. And if, you get a biopsy and it gets into your bloodstream, it could be very dangerous for you. So I'm not so sure I would go to another biopsy at this point. I mean, I would probably get the MRI and then and use more of the integrative
MRI
things.
Or possibly maybe ultrasound or something like that.
Ultrasound, no. I think you would probably want an MRI, especially if you're... Okay, yeah, because the MRIs today... the ultrasounds are great for looking at the size and so forth, but the MRIs really can see where the lesion is, how big it is, and they use this kind of a technique where they have a computer program and they can see if there's increased blood flow to that particular area, and if you would need a targeted biopsy.
More likely to determine whether there's anything going on in there. It's just really basically the inflammation that I've had for years.
I tell you, inflammation, we hear about it every day in this, whether it's environmental, whether we bring it out on ourselves, whether it's diet-related. I think a lot of it is diet-related, actually. I think a lot of it is the things that we eat, and we're trying to change that. And a lot of the things that I, have in the protocol for men, especially with those with low-risk prostate cancer, is to get rid of a lot of the inflammation, and the PSAs go down, and I think that would be helpful for you, Richard.
Well, listen, thank you very much for taking my call.
Sure.
And I'm going to see if I can get out to the seminar.
Yeah, make it out there. It's not that far. On a nice Saturday afternoon, I'd love to meet with you. And
I'm sure it's going to be terrific, my friend. Okay?
Thank you.
Great show.
Thank you very much.
Thanks,
okay,
bye-bye.
Have a wonderful day. 1-800-848-WABC. Just a few minutes left here in the studio, and then I go back to my home, where 26 18-year-olds are sleeping over my house. My son Alex had his prom last night, and we hosted the post-prom party. So at 3:30 in the morning, 26 kids got dropped off by the bus, and slept over, and I handed out sandwiches and did a tox screen on everyone. They were all drunk. No, I'm kidding. Actually, they were really sweet kids. You know, they all came up to me and said, "Oh, you know, Mr. Katz, thank you so much for having us. It's really nice that you were hosting this. We really appreciate it, and it's nice." And thankfully, my son is doing much better, and he was able to go to the prom, and he's going to graduate next week and go to college. In the fall. So congratulations to you, Alex, and to all those that are graduating this year. Congratulations on all your hard work. Well, we have just a few minutes left. The other things that I was talking about with Mr. Imus on the show this week was about the role of testosterone, and there's been a number of articles recently and studies that have come out showing that we're probably over-treating this condition. It's the number of men that have been given prescriptions for hormones, for testosterone replacement, has tripled. And unfortunately, many of the men have not gotten a baseline testosterone. They're just getting the testosterone because they're feeling weak. They're feeling, that they're not performing as well as they'd like in the bedroom or out of the bedroom, and need that boost. And it's an unfortunate thing because many of these men don't really need the testosterone. Some do, and those that do certainly can benefit quite greatly from it. But I think, and of course, I've talked about on the show here that all of these companies that are sprouting up, saying that you don't need to go to the doctor, that you can just take one of these oral testosterones over the counter. I think that, again, is a major problem. All right, well, Mr. Producer, let's see if we can go back to the phones at 1-800-848-9222. We'll talk to Eric in the Bronx. Good morning, Eric. How are you?
Yes, good morning, sir.
Yes, how are you?
I've never had a prostate test. I'm 65 years old. I'm on metformin and high blood pressure medication. And I don't know. I'm just afraid of going to take it. I mean, what's my, should I take it or just...
Should you take what, the prostate test?
Yes.
Well, the prostate test, if you're 65 and you do you have anyone in your family have prostate cancer? No.
Yes.
Oh, you do? You have
what did you say again?
Does anyone in your family have prostate cancer?
No.
Are you African? Are you African American?
Yes, I am.
Okay, then that puts you at that would put you at the higher risk, just being African American, because the studies have shown that African American men do get a little bit more aggressive prostate cancer and should be screened earlier. So you're 65, you've never been screened. Yes, I think you should need to get the test. The test is just a blood test, sir, and a digital rectal exam. That's what you need. Yes.
Oh, the blood test? Oh, okay.
Yeah, the blood test. I mean, why not get the blood test? Yes.
I mean, I've had several blood tests, Nate. I don't know if they took for prostate. Is it a special test for prostate?
Yes, it's a special test. It's called the PSA. P like Peter, S like Sam, A like Aaron.
Because they always look at my PSA reports on my medical reports. They always tell me about my PSA.
Yeah, no, I think you should. They do tell you about your PSA?
Yeah, they always mention the PSA is not high or anything.
Okay, then you've had the test.
Yeah, okay. I didn't know that was a prostate test.
Yeah, PSA is the prostate test.
I thought it's the one where they you take you don't drink or eat anything at night, and you come in the hospital and they do some type of a test on your abdomen.
No, that's not it. But Eric, you should come out to our. Thanks for your phone call. It sounds like you need more information, buddy, and you need to come out to the seminar. And that seminar, if you want to sign up, this is the last weekend that we're talking about it because the seminar is next weekend. That's June 15th at Garden City Hotel, and you just need to sign up at menshealthseminar.com. That's menshealthseminar.com. All right, Mr. Producer, who is on the phone now for us? Anyone else? No. Okay. Well, yes, we have a gentleman on the phone call. Good morning, sir. How are you? Okay. We're waiting. Okay. Good morning, sir. How are you?
I'm fine, sir.
Yes. How can I help you? We have just a few minutes left.
Yeah, doctor, I'm your patient, and you did this thing on me in November. The green light surgical procedure.
Okay. The green light surgical procedure. Okay.
Yes. But I've started experiencing something which is like when I have sex, I don't have ejaculation.
You don't
My
have
sperm
ejaculation after the green light. Yeah.
Yes, sir. My sperm don't come out.
The sperm don't come out. Well, you know what? That can happen after the green light. It can get better over time, but it may not. How is the urinating doing after the green light? Did that help you?
Yes, sir.
Oh, good. Okay. Well, that was the goal of doing the green light, is to help you with that. But the green light, and thank you for your phone call, the green light will allow you to urinate better, but should not affect the sexual function, really. Although you're right, not as much of the semen may come out after a green light. That can happen. Yeah, I mean there's really no way around that, I think. But the goal there is to keep you off of a catheter and improve your urinating at night and during the day, get your stream better. And it's an outpatient procedure. As you know, you didn't have to be in the hospital. So this is just done in an outpatient center, and it takes about 20 minutes to do. And I think it's a reasonable procedure for men that need it. All right. Let's go to our next phone call. Good morning, sir. How are you?
Hello?
Yes, hi. Good morning. How are you?
All right, very good. I'm listening to the program, but I just got to the end of it.
Yes.
This is Dr. Katz.
Yes, this is Dr. Katz.
What's his first name?
Aaron. This is me, Dr. Aaron Katz. Yes.
Oh, what am I, listening to a recorded show?
No, this is not a recorded show, sir. This is a live show. You've got 20 seconds. Do you have a question?
Oh, yes. Okay. I'm a 61-year-old male. I'm in good shape. I'm taking a new Vitality Ageless Male, a testosterone.
Well, unfortunately, you're going to have to call next week, sir, because they're just putting you on the music. You called late in the show. Thanks for your phone call. I want to remind everyone, once again, next Saturday, Garden City Hotel, June 15th, menshealthseminar.com. Please join up. And also, we have an educational series at Winthrop now for men. It's every Wednesday night at the Garden City, in Garden City. Give us a call. Tune in next week. This is Dr. Aaron Katz.